Hi, so my name's Brad Hawkins. I graduated in 2005 from the University of Birmingham, and I've travelled around the world to lecture and also to study different countries, different courses, different techniques on implant dentistry. So I've always been interested in the surgical side of dentistry, and I started implants in 2007, starting off with single implants and single teeth, and then building up to bridge work, and then more extensive bone grafting and full jaw reconstruction with multiple implants at the same time. So implants are hugely beneficial compared to other treatments as they don't involve cutting down other teeth. They're also a fixed tooth, so it's the closest thing we can give you back to your original tooth. And after it's settled in, it tends to feel and behave just like a normal tooth. So the first step would be the consultation, where we would meet and have a discussion about the various options we can give you. That might be implant treatment, it might be non-implant treatment. We always give all options available to the patient. And we discuss what the patient's expecting and what they are looking for from treatment, not only in terms of the cost, but in terms of the appointments involved and what's involved and how long it may take. And importantly, how the final tooth is going to behave and feel like in their mouth as well. So after the consultation, I will then develop a customised treatment plan and email that directly to the patient, and then our treatment coordinator will follow up on that and answer any initial questions they may have, and then the patient's welcome to come back in for a second consultation to discuss those options in more detail before we then proceed. And that might be a case of taking further scans or x-rays or models of the teeth to then start planning the implant treatment itself. Implant treatment can vary dramatically from a single tooth implant right up to reconstruction of a full jaw, either upper or lower jaw, or even both at the same time. That's something that can be called all-on-4 or same-day teeth, and has massive benefits over other treatment options in that we can actually take a patient from a completely failing dentition with multiple missing, broken or decayed teeth and convert them into a full set of fixed upper and lower teeth all in one day. It's a fantastic treatment for patients that need it. So not surprisingly, patients can be slightly apprehensive when they come in for implant treatment, but actually once it's all made comfortable and the position is numbed for them, then the recovery is very quick, and actually they're very surprised about how straightforward it can be. So for patients that are particularly anxious, or for the really complicated cases like full jaw reconstructions, we normally offer sedation, which is a great way to calm patients down. So it's not a full general anaesthetic, but it's more than a local anaesthetic. So patients will often come in, they'll be very sleepy, and then they'll wake up at the end of the procedure and won't remember anything. It's a really nice way to manage those types of cases. Particularly we find when converting a patient from a removable denture into fixed teeth, that can be the real biggest change, because they can start to taste the food again, their speech can be improved, they have massive improvement in their self-confidence as well. Come along, have a chat, we'll look at your situation, we'll look at your case, and we'll discuss the potential options you've got, whether it's implant or non-implant, and then we'll give you the best options we can.